But there is such an amazing benefit to having a caregiver at home where it eases anxieties for families. I personally experienced this with my grandmother. I hired a caregiver for her. She lived in Nevada. I'm here in Chicago. So to be able to have somebody help care for her at home and just help her deal with some just everyday tasks that she was too tired to do. And she was blessed in the position to be able to afford that. Not everybody can.
My next guest has spent 15 years in healthcare. And what's remarkable about her story is not just how far she has traveled, but why she kept going. From hospital liaison to vice president of strategy and innovation at Astra Health, a leading home health agency serving 11 counties right here in Illinois. Lisa Henderson has built her entire career around one belief: that people deserve to feel guided, not lost, when navigating in a healthcare system. Lisa is known for something that is rare in her field: a combination of deep clinical knowledge and genuine, unhurried empathy. She leads her team with clarity and compassion, and she has an extraordinary gift for helping patients and families find confidence in some of the most uncertain moments of their lives. Insurance navigation, discharge planning, care transitions, end-of-life discussions. Lisa meets people exactly where they are and walks with them forward. Today, Lisa is going to help us understand something essential: why the best time to plan for the future is always before you need to. We'll talk about what most people get wrong about senior care, how families can build real confidence navigating these transitions, and what it means to have the right hands in your corner when it matters most. Lisa, on behalf of every family listening who has ever felt overwhelmed by these decisions, welcome to Sage Pathways.
Thank you so much.
I'm so glad you're here.
Thank you so much, Sun-Hee. It's an honor. It's funny because how did we once first meet is really in this situation.
Yeah.
And I think what's so great is having the ability to connect with others and just being a guide and trying to teach them what I've known and what I've learned. But honestly, it really takes an entire village of people. And the healthcare world can be scary, especially when you don't know everything. But as long as you put the best foot forward, people can have the security in knowing that you're going to be okay, you're going to get through it. I'm excited to talk to you today and explore some of the things that we have worked together on before too.
Yeah, absolutely. So I want to start with this. What do most people misunderstand about senior care?
I think first and foremost, I think the most common thing that happens is obviously just not being prepared for that situation. Nobody plans to go into the hospital. Nobody plans to be at the point where you maybe can't live on your own anymore, or maybe you need extra help. And I think that also another kind of misconception is Medicare covers everything. My insurance covers everything. Medicare covers that? And I think a lot of time has been spent just educating people and helping them understand that knowledge is power, and it's okay to have conversations now before you get to that point. And although I'm younger working in a senior healthcare industry, I think it's important to, even in my personal life, to help others understand, make these plans now. It's okay to have these serious conversations now. Know what your wishes are now. So for when down the road does occur, everybody knows what you want. And I think that's very reassuring for family members as they're taking care of loved ones. Yeah. So I think that first and foremost, that's really what people aren't prepared for. And obviously some things involve financial costs, but insurance does cover some levels of care. I'm currently in the home health care world, and it's an amazing benefit to patients that is covered by insurance. It's following a hospitalization, but I think that for all senior living and senior health care, there are a lot of different options. Being prepared and at least knowing, okay, if this happens to me, this is what I need to do. That really does just ease the anxiety for your own being your own individual and for your family.
Yes. Oh, yeah. And one of the things that what families are going through, they don't even know what the options are.
They don't.
So how do you communicate when there is a crisis and then people are scrambling to find an information? What's your approach to ease them and then seeing, at least in helping them some clarity?
I think it depends on the exact situation. So usually where I get involved is a hospitalization. So something occurs where somebody is hospitalized and then they're given multiple options when it comes time to going home or wherever the next discharge location is. And I think people really unfortunately have to understand that once you're in the hospital, the goal is for them to have you leave. The goal is to not stay in the hospital. The goal is for you to get better, transition to a different level of care. So a lot of these conversations are taking place at that acute hospitalization point. And then what's really complicated is that there's so many amazing providers that are involved in that process. There's doctors, there's nurses, there's CNAs helping people, right? There's discharge planners, social workers, nurse case managers. And unfortunately, all of these terms are used interchangeably, so it's very complex for people to wrap their heads around it. And I think when those moments happen, just where I've come to be a resource is say, okay, here's where you are now. Here's where you can go. And these are the questions that you have to ask yourself. And then again, for the future, depending on where you're at, be prepared to maybe make these choices down the road.
Yeah.
And that's not always the easiest conversation to have. Let me just preface with that, okay? Being a patient yourself in itself is difficult. How do you make these choices when you're sick? Right. And as a family member, how do you even wrap your head around trying to help your loved one? And there's so many choices and they're so afraid to make mistakes. Yes. So it's really important for all of us as healthcare providers, as people that work in the industry, we really do have to continue to take a step back and put ourselves in those patients and their families' shoes. It's really hard to do. We've become desensitized. Our clinicians have become desensitized in some areas. Our nurses, they're very overworked and overwhelmed as well, especially hospital discharge planners. It's a very difficult role. And I think it's important, no matter where you're at, is just try and put yourself in their shoes. And nobody wants to be sick. Again, working together as a team, we really are an extension of our patients and our families. That's what we're here to do. So it's remembering that in mind. And again, as the families and the patients themselves, when you're sick, it's really hard to see straight. But from a family perspective, just before you jump to a conclusion, understand everything around you. It's okay to ask questions. Right. It's okay to take notes. It's okay to get multiple opinions. You have that right. So do it. It's okay. So I think it's so fast-paced and moving, so it's hard to slow it down in the middle of it. But again, I think preparing for those moments and just say, okay, if I do approach this situation, or if I know my mom's sick, and if she goes to the hospital, what does she want from me? Think about those things now. Don't wait until it's too late.
Right. So when do you typically get involved to talk about these matters with the patients in the hospital?
Sometimes we get involved before. Depending on if patients are at home, you can actually have home health services ordered by a doctor. So the benefit of home health services is that at any point, if you are deemed homebound and have skilled clinical needs, you can actually get home health. But usually when we get involved is from the hospital notifying us that a patient is in need of home health care. A referral gets sent to us. And then we have our liaisons that actually will go, many of them are clinical professionals as well, and they'll go and talk to patients and families in the hospital, preparing them for going home. So that's usually when it happens. It's when they're hospitalized, we get a referral from a hospital case manager who does the discharge planning. Or sometimes too, we get calls from patients, just families looking online and seeing, I need a home health option. My mom's at this hospital. So it is multiple avenues, but usually those are the most traditional.
Let's shift the conversations a little bit in general. How can the people improve the quality of life as we age? And then we are in hospitalizations. We know this is something that we have to make decisions in a fast pace. But when we have a time, how can people improve quality of life as we age in preparing for families and individual themselves to feel confident and then being surrounded by the resources like yourself?
Sure. I think the first step is to truly put yourself in that situation and to have a game plan. For example, I've been very blessed to be around elderly people my whole life. And my grandmother had recently passed away last year at 91 years old. She lived independently up until that point. But what she did very well, and it really taught me something too, to be in the midst of that, is that she had an entire game plan. She knew where she wanted to have her funeral. She knew where she wanted to be buried. She knew if she ends up maybe something happening to her clinically, what did she want? She passed away on hospice. And I felt like her geriatric care manager in that moment because there were things that she wasn't familiar with. And then I had the amazing opportunity to help educate her and help her make those decisions. But a lot of it was already done. And I think it really did ease the anxiety for my family. I think that's something that, as the individual, picturing yourself as the patient, or do you want the rest of your life to look like? So that's from a medical perspective, but also from a longevity perspective. Like, where do you see yourself living? How do you want to be a snowbird? Do you picture living in a different city? Think about those things now. It's okay to think about that now at any age. And obviously, if you're reaching retirement age, it's okay to think about these things and have a conversation with your family. Maybe you didn't make decisions yet, but the bottom line is talk about it. And if you could have a written, solidified plan and execute the plan, and again, the plan may change as time goes on, but at least a starting point to know what to do down the road, it really does ease the anxiety for everyone. And then you can enjoy your life knowing, okay, I approached the hard part. I know that if X, Y, and Z occurs, this is what I want. Okay, moving on. And if it doesn't, wonderful. But now I know that if this were to take place, okay, I'm prepared. And my family's going to be prepared because I don't want them to even think about it. So I think that's really where people miss the mark. But there's still opportunity. I think no matter what age you are, I think that you can have these conversations even if you're 90 years old or even if you're as young as 40. I think living through those experiences, I've been blessed at a young age to also live through loss and see what and it's okay to talk about it. It's okay to talk about it.
It's almost like the best gift is handing down peace of mind for families in these situations and honoring these wishes. I think those are really important, and every family should take time to address these very important decisions. So when is the right time to seek care? You had a clinical background, and then you're still working closely with a lot of a hospital. When do you see the individuals to find the right time to seek the care when their bodies changes or when there are some new diagnosis has been placed on them? When would be the right time to talk about this?
I think a lot of the times, let's say outside of a hospitalization, that if you've been given a diagnosis that may be life-changing, right? It's important to think about all the aspects that diagnosis includes. So I think in my senior living world, I think in a diagnosis we often see as like congestive heart failure, for example. And I think for people that get diagnosed with heart failure really need to think about, okay, I have this new diagnosis, and what is my life going to look like moving forward, but what are the resources available to me? And I think that's where you need to seek out education and working with professionals. And I myself am not a clinician, but I've been working in the healthcare industry for a very long time, and I'm so blessed to work with amazing clinical professionals, nurses and physicians and nurse practitioners that really do want to help patients and make a difference and educate them. I think that's really important to also think about all the things that could encompass your care. Maybe initially as you get this diagnosis, and then asking questions like, what does this look like down the road for other patients with my diagnosis? But it's also okay too, that I think this is something that is, again, something that we all need to think about, is the end of life quality too. And there's a lot of services like palliative care and hospice care that unfortunately have this stigma, but people really don't know about it unless they experience it. And then once they come to experience it, they realize, wow, this actually wasn't as traumatic as I thought it was going to be, and I got to see my loved one die peacefully, or maybe this is something I may want for myself if I end up in this situation. So being exposed to it and learning more about it really can change your perspective. And I think that's something that, especially if you're a patient with a new diagnosis, like something to just think about. But it's okay to ask questions, but don't be fearful. Seek knowledge. Don't live in fear. And I think there are a lot of wonderful people that, this is why we're in the business we're in, is that we really want to make a difference in people's lives and help. So you'll be amazed to see all the help you get when you're in your most troubled times. And I've been fortunate enough to have a lot of people around me too, personally, in the hardest times of my life. So it's important that we support one another. So I think that's something to think about is educate yourself, ask questions, research, go online, start Googling, talk to professionals in that call, make phone calls, have conversations. It's okay before you make a decision. Sometimes it feels very fast paced because if you're in the hospital, like sometimes you have to make a decision immediately. But at least if you did this in advance, you're going to know if this ever happened to me and they mention the words rehab, it means I might have to go to a skilled nursing facility for a couple weeks. Okay. If I do, where should I go? All right. I live in this area. Here's some skilled nursing facilities by my house. Maybe I'll want to go check it out. No one's going to harm you for checking things out. It's good that you're putting this in your mind now and trying to have a little bit of a game plan.
Yeah, and I think this conversation that you and I are having really at an entry point for many. Oh, I didn't know this is also an option, right? Because we have a taboo against talking about end-of-life planning. We are scared, quite honestly, when you're in a hospital. Personally, I also have them to share of that. I'm just navigating in the middle of the crisis. And having an expert like you and a great communicator, you are a great communicator. I want to hear more about Astra Health. You are VP of Innovation and Strategy Department. Can you share a little bit more about your role?
My role is really spent working with healthcare systems and helping them improve their transition of care. So from patients being in the hospital to going home and providing them with home health support, but also setting the expectations for our healthcare providers on what happens at home. So what does the home health space entail? And when a patient is deemed homebound and we're providing skilled services, so usually what that involves is nursing, physical therapy, occupational therapy, speech therapy. These are patients that are at home. They're not able to leave their home. They're coming home from the hospital, but the goal is obviously to get them back to their baseline, if not better. And most of my job is working with larger healthcare groups, physician groups, hospital systems, in helping improve that transition of care. And a lot of times it's as simple as communication. And there's a lot of misunderstanding that goes along the way. Think about it, there's so much exchanging of hands, right? You're in the hospital, and then maybe sometimes we're seeing patients from rehab to home. They go to a skilled nursing facility, then they go home with home health, then they go to outpatient services. What does all this mean? And then also when patients are not able to get back to their baseline. Maybe they need more care, right? We need to be open and transparent about conversations. And I think what's happening is that the healthcare shift is that we're doing, number one, we're doing more with less, but also we're doing more at home. Is becoming the new hospital, the new skilled nursing facility in certain ways, not when it comes to surgeries and medications and things like that, but we are seeing more complex patients going immediately home. So we have to be prepared. And so a lot of my job is spent learning from clinical experts within our agency and also working with doctors and leadership at healthcare systems to help work together as a team to make the most positive situation for patients at home. I love doing it. It's an amazing role. I think that where I work, I'm so blessed because it really starts at the very top of our organization. And our ownership, someone that I really do deeply respect, our owner, Oscar Aragon, he also, like myself, has grown into who he's become today by helping patients every single day. And just like having empathy and knowing that nobody wants to be in this situation and we're here to help. So that's really important when you're dealing with the home health space. Something that people are also not prepared for that we specialize too in is private duty caregiving. It comes to find where people need a caregiver. Again, the common assumption is that it is covered by your insurance, and unfortunately it's not. But there is such an amazing benefit to having a caregiver at home where it eases anxieties for families. I personally experienced this with my grandmother. I hired a caregiver for her. She lived in Nevada. I'm here in Chicago. So to be able to have somebody help care for her at home and just help her deal with some just everyday tasks that she was too tired to do. And she was blessed in the position to be able to afford that. Not everybody can. So we're here to help provide options when it's not affordable. We're here to say this is what is available to you. We really are acting as personally. We're here to provide resources for people, even if it's not within our scope. But I think that's something to, again, part of the plan. Do I want a caregiver? Do I want my family taking care of me? Sometimes people don't want that. They don't want their family burdened by their health needs, right? They want to hire professional help. So these are all things to think about now.
Exactly. One of the things that most of people are confused is the difference between home health and home care.
Correct.
So you and I, we are encountering a lot of patients and then families who really need to make decisions. But sometimes these kind of terminologies can be really confusing. So if you can break it down in a simple term, what really defines home health and what is home care?
Absolutely. I think that's the best question. I think that is the most common. And I've actually seen hospitals refer to home health as home care. So that's even more fun. So what I would probably say is the number one key differentiator between the two is that home health is involved with a skilled clinical need. You have to be homebound. It is billed through insurance. So if you have a hospitalization, or let's say that you are deemed homebound and have skilled clinical needs, what does that mean? It means that your diagnosis requires a registered nurse to take care of you, to evaluate you at home, and potentially you might need therapy service as well. There's also another complex part of this is that you may need a home health aide, which can be billed under your home health episode that is different from home care and a caregiver. So there's lots of fun there that we have to educate people through as they experience it. So home health, first and foremost, skilled need, okay? Homebound, it's billed through insurance, okay? Then home care, you'll usually hear private duty, caregiving services. Those are not billed through insurance. Some future is that some Medicare Advantage policies may have a benefit for caregiving. So I know that is really on the horizon in some situations. That's not every situation. So I think at the end of the day, it is where you're paying out of pocket to have a non-medical person. So they're not providing medical care like a nurse would. They're dealing with ADLs, activities of daily living. They're helping with showering, bathing, assistance with maybe eating, maybe with ambulating and transporting from place to place within your home. So those are the key differentiators where it's a non-medical need for home care. So those are, I know I can go on and on. I think all of us could because there's so much within, but it's important to know that those are really the big two key differences. Medical, non-medical. There you go. We can start with that.
Thank you. Thank you so much. It is very important that we know that there is a different way of asking for help, right? Identifying those needs before. As we are coming to an end of this session, and time just flew by.
It always does.
Let's talk about some of the takeaway, your podcast session here. How to prepare expected life events. If you can, maybe 2 or 3 points, how can we prepare for it?
First and foremost, develop a plan, okay? We don't have to have a plan as complex as to the very solid detail of end-of-life care, but just start putting things down. Start thinking about it. Yeah. And just have some key things in place. I think that's the first thing you can do. Also, there's a lot of resources and tools available as well. Medicare has a care compare site. So you can actually literally Google a home health compare or a nursing home compare. And Medicare has an entire listing of what is certified through the state of Illinois, for example, and you could look and see reviews on places and home health agencies and their star ratings. But it's also important too to investigate yourself. So in addition to that, go check things out. Go physically to places. Call and talk to people. I think that's really, those are some initial steps you can take. But it's okay to start all of this now before you get to a point where you're in a situation you were not prepared for. Again, you can't prepare for everything. But at the end of the day, if you just start putting some things into reality, or maybe even think about tackling the most difficult thing first, that might ease your own personal anxiety and fears. Yeah. To just know, okay, at least I thought about this, and then now I can tuck it away for now, and just there's a little bit of a plan that I have in place.
Mentally, I think it will give peace of mind. Navigating this very difficult time, not only just ourselves, but also for our loved one. You're giving them a peace of mind and then having something. I thought about it. This is the action plan. A great gift.
There's nothing better than that. Truly easing the peace of mind for families too.
One of the things that we talked about throughout this conversation was a different level of care. So how can you help the people who are very new to this? And how can you help the people understand that there's a different level of care in general and senior care?
Sure. I think What's most important is what you could do now too is researching certain key terms. So first and foremost, if you're in the acute care situation, which is the hospital, right? And then you may end up needing to go to a skilled nursing facility. And oftentimes the skilled nursing facilities have short-term care. So that's typically rehab, where you're there for a short amount of time and then you can transition home. Sometimes you actually need long-term care. Some skilled nursing facilities offer long-term and short-term. Some facilities offer skilled nursing long-term that is memory care. So I would say there's a lot of nuances within the skilled nursing piece of it, but then there's also other levels of care like assisted living, which obviously is not going to provide as much care as a skilled nursing facility would. We call it the continuum of care within our world. We hear that every single day. They're going through the continuum. What is the continuum? Seems a little grandiose, but it is sometimes overwhelming to learn all of those facets within the continuum. And even, I should even preface with that, from the hospital, you can even go to an IRF, as we call it, where you're doing inpatient rehab. So that's another level of care that sometimes you may go to from the hospital to inpatient rehab and then to skilled nursing and then home. So there's a lot that goes into it. But at the end of the day, I think it's important to just know the keywords and just looking up and doing the research for yourself to say, okay, if I need assisted living, this is what's going to happen. Right. Or if I have to go to rehab, here's where I want to go. And then, again, can't prepare for all of it. But I would say those are most of the common levels of care: hospital, inpatient, rehab, skilled nursing, home health. And then if you have your other long-term levels of care, assisted living, supportive living, you have to pay for those. Supportive living also has a facet of Medicaid support too. That's actually something I just ran into the other day, where a family friend of mine was looking at supportive living facilities because they could not afford traditional assisted living. Illinois is very special to have the supportive living licensure, so that could be an option for families. So you would eventually go on Medicaid at those facilities. So it's just, those are all the potential options. I think at the end of the day, it's just good to know, maybe on a higher level, what some of them are. It could be overwhelming.
Yes.
And ask for advice.
Right.
If you felt that you want to learn about it, there's so many experts and people at your disposal who want to help. So that's really important to utilize as well.
This conversation is so formative. Your wealth of knowledge and compassion through this conversation has been invaluable. I know how you are passionate about helping families in all different levels.
Thank you.
You really are truly meeting where they are. Thank you so much for coming.
Thank you so much, Sun-Hee, for having me. It was a pleasure.